Okay, I'll call this meeting to order. It is July 31st, 2024, and it's 2:30 p.m. and we're meeting with our benefits, our benefit renewal with advanced benefits, and I will turn it over to you guys.
Very good. Very good. Well, good news since
Can
last
you
time we
state
met.
your name?
Oh, yeah.
Sorry.
So James Perkinson, benefits advisor with Advanced Benefits.
Accompanied by Mark Fisher, Benefits Advisor.
We're here today to deliver the renewals for upcoming renewal for October 1st.
Okay.
Just as a reminder, we're with Blue Cross of Idaho through the GEM plan, which the GEM plan is a collection of other public entities, mostly counties, throughout the state of Idaho, basically pooling together for what I like to call the Costco effect, bulk purchase pricing. And with looking at our renewal this year, it's definitely in our favor to be part of the GEM plan, just looking at our what we consider loss ratio, so how much money we pay in premiums relative to how much money gets paid out in claims from Blue Cross. So I think last time that we met, our loss ratio was a little bit higher. So it's good news that we're trending on the downward slope. I believe last time we met back in May, we were around 123 for our loss ratio, whereas our most recent one through end of May, we're at 107 for the year. So for every dollar in premium Blue Cross essentially is taking in, we're spending $1.07 in healthcare costs here. So with that, GEM plan comes back, calculates the renewals, right? And part of the bulk pricing piece is knowing that some counties and entities within the GEM plan are running very well, and some are running on the other side of that. We're on the other side of that right now.
Mm-hmm.
But through that, right, for those that are running maybe less of a loss ratio, they're not going to get as great of a renewal, knowing that they're part of this bulk program. In the sense that for those that are running a little bit on the hotter side of things, running over 100%, to help those counties out as well, right? We're helping each other out in that scenario. So the Blue Cross GEM plan came back with a 5.9% increase for our next renewal effective 10/1/2024. So in some reference of, private companies or things like that that might be on their own, and we're looking at a similar loss ratio here, we would probably be somewhere of a 25 to 30% increase if we were a standalone. That's the power of being with the GEM plan and having kind of that Costco effect of bulk purchase pricing, is because if and when, right, there's cycles that we go through. When we come back and we say, hey, we have a 75% loss ratio in the future, we might not get as favorable of a renewal as if we were completely on our own. But part of that is, right, paying it forward for other counties that might be in that hotter cycle that we're currently in right now.
Okay.
Taking out the spikes.
Yeah.
Yeah.
Really helping even it out, especially when we're talking about government entities and we're budgeting season. Talking about 25-30% increase on one of the highest operating expenses for a county, that's very hard to budget for. Okay. So very thankful that we're part of the GEM plan.
And last year it was 9%. We had a 9%. So this year it's a little better.
Yeah. We did go through, and one of the documents that is also in here is we looked at, again, just for consideration of a couple of different plan options. So we have the agenda on top here. Second page is really the experience that talks about our loss ratio month over month, where we reference that 107 there. Third page is the multiple options with the GEM plan, just for considerations of what would it look like if we move some of our plan design. So you'll see current versus renewal, kind of that middle column there of just keeping everything the same. What does that look like? Down towards the bottom, we have current rates, renewal rates. That's where you're seeing that 5.9% increase. To the right of that, option one here, if we looked at increasing our deductible from $750 to $2,000 from an individual, and then family from $1,500 to $4,000, there's also the increase at out-of-pocket maximum, and that's where you'll see the different coloring there. If we move to that plan design, Gem Plan would give us a flat renewal, 0% from a budget standpoint.
Okay.
Option 2, probably a little bit more on the palatable side of things, of keeping deductible out-of-pocket maximums the same. What's really changing on option 2 here is the structure on prescription cost here. So you'll see like preferred generic from a $7 copay to $10, so forth, all the colored pieces there. That would result in a 4.5% increase if we decided to go with that sort of plan design.
Okay.
So I'll pause there for any questions thus far.
No.
No,
Go ahead.
I said I'm following you. I'm still here.
Okay.
Perfect. So one of the things that we also prepared kind of as a supplemental is a magnify benefits. So this is a report that we do with our clients and anybody really Idaho-based employers to say, how do your benefits compare to industry, other Idaho employers, as well as some national data as well. So the first few pages are pretty static. It kind of goes with the entire book that we have available. So in addition to the benefits piece, we typically have a highlight section.
Okay.
You know, we've done mental health, remote work, things like this. This year's focus is really financial wellness and talking about what do employers offer as far as financial wellness with like debt coaching or 401ks, things like that. So you'll see some information there. The one thing I really want to point out is on page 1, that first page that shows average plan individual deductible. What has the trend been? This is the 5th year that we've done this benchmarking report. And what has the trend been for employers? And over since 2021 through 2024, a 31% increase in deductibles for the average Idaho employer here. So that's one amazing thing for Shoshone County is we've been able to keep our deductible, I think, flat over that same time frame, right?
Mm-hmm.
So while other employers are increasing 31% of offsetting some of their costs to their employees, we've been able to keep that 31% here. So that's a really great talking point when we're talking to employees about our healthcare plan and what we're seeing in the industry there. Page 2, more about that financial wellness piece. Page 3, health savings accounts, learning more about that. We don't currently offer that, so kind of talk about that. Page 4 is more about the cost and the rising costs in healthcare and what we're seeing when it comes to employees being engaged and satisfied with their benefits package. So number 1, obviously, being their overall competitive total compensation package. So that's salary as well as benefits, training and development, implementation of technology solutions, and so forth. So I don't want to leave this behind for you guys to kind of review. The big things to really take away is when we get to page 5 is really being able to compare where do our plans stack up, and we look at deductible compared to, for the Gem Plan PPO being $750 compared to the industry average being $1,700. So what, nearly 2.5 times what our deductible is there. Idaho PPO, so not just specific to our industry, as public administration, utilities, and transport. Idaho PPO, nearly 3 times the deductible on a PPO with $2,100. We also look at the average individual out-of-pocket maximum with our plan being $2,250. The industry PPO, $4,632. Idaho PPO, $5,700. So that means when our members are needing to seek services healthcare, they're paying significantly less out of pocket when they experience their healthcare than industry and other Idaho employers. Page 6, some good information about co-insurance and co-pays here. The $10 copay is really for that choice doc. If it's a non-choice doc, it's $30, so right in line there. Page 7 is kind of just if we were to take the median plan design on PPO versus a high deductible health plan, what do those plan designs look like? So if you just wanted to know, split it down the middle. Page 8, what plans do we offer? So as you can see, the orange is what Shoshone County currently offers versus what do industry and Idaho peers. So we have a lot of good stuff going for us there. Kind kind of skip through page 9, page 10 is some really great information about innovative benefits that Idaho employers are offering. Page 10, again, back to the financial wellness piece. This is a little bit of statistical information from United Way of North Idaho about average hourly wages and kind of who's considered to be that lower income stature and what their general occupations are. Percentage of workers living paycheck to paycheck, so good to kind of know there. Page 11 and 12 is back to just comparing our premiums and rates compared to industry peers. So you'll see top left of page 11 here is our gross rates are really right in line with that industry PPO, even though we were 2.5 times lower on that deductible, but yeah, we're right in line premium wise. So I like to see that. The really below that is the employee cost, and this is where you guys are very generous when it comes to other peers with the benefits that employees would pay on a per paycheck basis there. On the right hand side on page 12, that's taking that same information from employee only on the left hand side. The right hand side is employee and family rate. So same deal, very much in line with our gross rates. And again, going back to the employee cost for a family to enroll on Shoshone County's health plan is significantly lower than industry, no matter what plan design, Idaho, and even national data. So this is something to shout from the rooftops to employees about their healthcare costs comparatively to other Idaho employer peers.
Okay.
So I just wanted to go over that data to kind of compare with, when we're talking about our increase here, what plan offerings we're looking at, that we are doing very well when it comes to the health plan that Shoshone County offers.
Okay. Do you have this booklet in a PDF?
Yep.
Could you email that to me, and then maybe we can email it to all the employees to kind of give them a reference of, or email it to
I was just going to say, sounds like a good idea.
Okay. Email it to Tammy.
Okay.
Forgot your name for a minute.
That's all right.
So any considerations on any considerations on wanting to look at different plan design, or are we okay with the current plan offering that we have now? No decision has to be made today, but this is a takeaway you guys can look at and consider.
Okay. What do you think, Commissioner Dose? Do you have any concerns on, would like to look at other plans?
I don't have enough budget information yet to know that. I'd be inclined to sit where we are until we get through this budget.
Okay. I would agree.
And there's some leave behind material so you guys can look at the numbers. You'll see at the very bottom the annual dollar based off of the current enrollment census that we have, and what the actual dollar amount increase is over each of these plan designs. So currently at the 5.9%, it's about $115,000. Again, option plan 1 with the increased deductible and out-of-pocket maximums, that'd be a 0 compared to what we're spending now. The option 2 with the different prescription program, about $88,000 difference by switching to that plan design.
And that's total premium, doesn't take into account what you charge the employees.
Correct. So some of that consideration could
Where's
also
that at,
page 3. Yeah, down here at the very bottom line there. That
Okay.
would be the
Okay, so this would be it. This is what our increase would be, is
Yeah, so if you renew,
115,000. Okay.
if you renew as is, don't charge the employees any more to be
Mhm.
on the plan.
Mhm.
That would be all you.
Okay. Okay.
and that's always a consideration too, is changing, employee contribution where maybe they're contributing either a dollar or percentage to help offset that 5.9% increase. So saying, hey, we'll keep plan design the same, but maybe they contribute $10 or X percent. And we can run the numbers on that too if you'd like to see what that would look like too.
Okay. And did you hear what they were saying there, Dave? Commissioner?
Yeah.
Okay. So we would have at 5.9%, the total cost of the county would be $115,580. They can split that up with the employees and get us, so we have some room to work if we if we have to.
Right. That makes sense.
Okay.
All right. So that was the Blue Cross renewal there. So Delta Dental came back, and they are looking at a 1% admin increase. So as a reminder, we are self-funded on the dental plan as well, so we pay the claims as they come in. So when we look at, and there's some documentation included in the packet here too, our number of claims have increased by 8.9% year over year at this renewal, but our paid claims have come down by about 10%. So kind of where they're coming in with this 1% increase is saying, hey, we're doing more work by processing more claims, but at the end of the day, our paid claims are actually decreased as well.
Okay.
I believe that 1% translated to about $750 if we look in the packet here. There's an experience comparison summary and there's an administrative income. So for 23-24 plan, thus far paid Delta Dental for the administration of the plan about $7,488. So a 1% increase is about $750.
Okay. And that's kind of like, that's total.
That's total, right?
Correct.
Yes. Yep.
So if our claims continue to trend downwards, that's good news because then we're paying less for the plan overall. We're just going to be paying Delta Dental 1% more to administer our plan since our number of claims have increased by nearly 9% year over year. I know last year we ran different plan designs when it came to Delta Dental. We didn't make any changes from that standpoint. And it didn't sound like there was really any interest in changing any plan design last year as well. So we didn't, at this moment, run any plan design differences on the dental. But I can certainly go back to them and see if we want to look at anything as far as changing plan design from that perspective.
Okay.
What's our total premium for that Delta Dental?
Great question. So the premium that we pay is just that administrative cost, which is roughly about that $7,500. That's the fixed cost there. But if we look specifically with including the paid claims as well, we would add the administrative income along with paid claims, which would put us right around $70,000 because the paid claims for this past year was $62,400. So add the $74,888 to the $62,400, and that's roughly our total cost all in. Because Delta Dental, we are self-funded, so we pay those claims as they kind of come in.
Okay.
Thank you.
Yeah. And last but not least, we have the Gallagher Viva, $750 in funding. Any changes that you guys want to see specifically to that?
Not at this point. We haven't seen the budget yet.
Yeah. Let us know, and we can run numbers and calculations based off of that too. But just a reminder that that's part of our benefit package that we have. Some housekeeping items, so some things that are coming up. Want to let you know that our team will be reaching out with once we kind of have everything finalized, the compensation disclosure as far as what does advanced benefits make as far as the commission for servicing your guys' account and everything like that, as well as just our general kind of housekeeping item of what we call our fast fact sheets. So that's essentially if employees call into our office, we have a fast fact sheet to be able to say, what's the employee cost? What plans do we have offered? All these sorts of things. It's just a nice quick 1 or 2 page to show what do our rates look like, things like that. So it's just a really in-house thing that we just like to have signed just to confirm that we have all the correct information in there that we're talking and communicating to employees when they call into our office.
Okay.
So that'll be coming from probably Michaela or Angela, but
Once the renewals are also.
Yep. Just some compliance reminders here. So, at renewal time, that's where the fast fact sheet, that's the abbreviation there. So compliance alerts still coming in for anything that we need to be aware of. CMS notification, 1095, PCORI, CA, RX reporting, which the carrier does most of that for us. We do have some compliance bundles that go part of the renewal process and open enrollment that we put into the employee navigator experience that we have employees check off, make sure that they've completed their compliance notification. So if they ever come back and say, you never gave me this compliance notice, we can clearly go back to the electronic enrollment platform to say, yes, you did, and you clicked and signed that you reviewed it and you received it. So that's a good thing to have in our compliance bundle. It's always a little bit more tricky when it's a paper enrollment and you have to hand somebody a packet, and do they receive it? Do they not receive it? How do you approve it? It's one of the things we really love with the electronic enrollment is they have to go in, check the box saying that they received all their compliance notifications.
Okay.
Magnify. So yeah, I already went over that information. So if you guys have any questions when you review that, just let us know. I'm happy to go through that in greater detail. But I know, time is of consideration, so I didn't want to go line by line on every page that we have and every piece of documentation there.
Okay.
And then lastly, to finish up, open enrollment strategy. So I know it's a little bit quicker of a timeline than we had last year. Looking at the notes, seemed like the Gem Plan committee got together a little bit sooner to finalize rates and get us rates about a month earlier last year, so gave us a little bit more of a lead time.
Mm-hmm.
So these numbers are flexible, but this is kind of what we had previously talked about, getting open enrollment dates in. So some of that being final decisions would preferably be by 8/7. That would allow our team to be able to go back, build the open enrollment portal, the benefit guides, all those things. Once we have final decisions on rates that we're going with.
Okay.
If we need to push back any of these, that might cause some of these other dates down further below to also get pushed back a little bit further, just to make sure our team has that due diligence of making sure all the correct information is in the system.
Okay. So you want us to have a final decision on the rate by 8/7?
That'd be ideal.
Yep.
When will you finalize your budget workshop stuff?
Yeah.
That's probably the driving force.
Yeah. We have our budget process started right now. We just got it today, so
Okay.
we got to review it.
It's been 2 weeks probably.
Yeah, it'll probably be a couple weeks.
Yeah, most of our budget hearings are not finished until I think 8th and 9th of next week.
That's correct.
Yes, the 8th and 9th.
Okay.
So yeah,
Is that
so the
okay?
following week, yeah. I mean, these are just ideal, but
Okay.
obviously we have to work around your schedule with budgets and those things. So
Yeah. This is not set in stone. It's just
Okay.
kind of here's where.
It's a
And
target.
if we're right there at the 8th or 9th, we can probably squeeze and still make all the following ones work.
Okay.
So I think that was we work with Michaela and Angela on for.
For open enrollment.
Yeah.
For the dates. Yeah.
So if we're really still kind of on that 8th, 9th, I'm sure we can still make all of that work with
Oh,
the
yeah.
open enrollments, getting your access to the employee navigator experience, doing your walkthrough before we open that up. So it's just if we start to get probably too much further, if we're getting close to, the 15th, 16th, we may not be able to open by the 22nd. So just active communication on if things do go a little bit long, we might have to push back open enrollment by a week or
Right.
so. So
Which is still plenty of time for 10-1.
yep, plenty of time.
Okay.
What we find with open enrollment, as you guys probably have seen, is a bit of that what we call reverse bell curve, where we open it up. You got those few early bird get the worm kind of things. They get in there, do their open enrollment first couple days. Then there's a lull. No matter if it's a week or a month or 2 months, there's just a lull. Nobody's in there, and then everybody rushes to get it in before the deadline. And so, that's where we typically recommend a week, maybe 2 at most, because you're just going to have that. And if you give people a week, magically they find a way to get it done.
Yeah, they do.
So, any questions on open enrollment or any outstanding items to
I
get
don't.
you?
No, I don't.
Yeah.
No, the
No,
portal
that's
works
good.
wonderful. It works wonderful. For
Get everybody in,
employees.
and
Yeah.
they can do it from home, do it
Yeah.
with their spouses.
And
you
it's easily navigable.
The one thing that was the to be determined was the health fair on if we are doing that this year or not.
Well, it doesn't sound like here because Shoshone Medical could not
Okay.
make it.
Yeah.
So the last time I talked to Angela, she was throwing on, I think she was on vacation or she was doing something, and I haven't talked to her again, but we were looking at maybe something visual, something, I don't know.
Okay.
She hasn't gotten back to me, and then I was on vacation, so which would work. That would work because the people that can't come here and make it, because last year we hardly anybody.
So one of the things that
So we're talking about a video perhaps or something?
That's what it sounded
Okay,
like.
gotcha.
And that might work pretty well for the employees that can't make it to come here physically.
Sure.
Then that way they can do it from home, like
Yeah,
you just said. They can do it, when their schedule allows.
Or sitting with their spouse.
That might work pretty well. I think it's worth giving it a try.
Yeah.
Maybe we'll get a better attendance.
the note on here is the ebook with embedded videos is a really cool.
She talked
Feature.
about that too. Yeah.
It's basically we can take the open enrollment guide that we typically have and then be able to put videos that are relative to that page or that subject in there. So if employees are curious about the dental program,
Right.
they can watch a video specifically on that. It's not just this 30 long minute thing that, nobody's going to, who wants to sit down and watch a 30-minute video.
Right.
It's bite sized where it's like, okay, this is very specific to this piece here. And if you have questions, you can call the advanced benefits team and we'll help walk you through that. But it's a good starting point.
Yeah, I think it's worth giving it a try.
Okay.
We might be able to reach more of them,
Right.
more employees.
More and more employers are doing that.
Yeah,
It's just hard to get everybody together.
it is. It is.
That's what we have on the agenda. So any other thoughts, questions, comments, concerns?
I don't have any. Do you have any, Commissioner Dose?
None from me at this time.
Okay. Any public comment?
Yes, I don't know if I missed it. What's the compared on the cost for premiums for the private sector to the county sector?
Yeah, great question. So that's going to be in this piece that I have here. But if we flip to this page, so here you go. So if you look at the top, this is the gross premium. So this is the total amount that effectively the insurance company is asking for to have the coverage there. When you look down here, that's how much an employee only is paying comparatively, and how do we compare to industry employers, Idaho employers, and national data.
Real low.
This is the employee side, this is the family side. So both of them you'll see significantly lower compared to what other employers are charging their premiums to employees to pay to have themselves enrolled in the plan and or their family. So as far as the rates that the insurance carrier charges, we're really right in line with industry peers, even though we have significantly lower deductible and out-of-pocket maximums on
So
there.
that's what you're talking here. So
So
we're actually above.
just slightly above on the industry,
Yep.
but when we look at, back to, I think page 4 or 5 on here, right? When we look at what is our deductible comparatively, here's where we're at, here's where the industry is at, right? So quite a bit substantially to then saying, well, we're not paying that much more to have a significantly lower deductible as well as out-of-pocket maximum.
I'm just looking from a taxpayer on the cost.
Sure.
Yeah,
I'm not an employee, so.
great question. No, and that's
Absolutely.
back to the plan that we're a part of. The Costco effect is, if it was Shoshone County as a standalone, we would, with what our rates and where our loss ratio, how much money we're kind of spending out as the insurance carrier, we'd probably be looking at somewhere between 25 and 30% increase. That's what the county would be absorbing a lot of that. But
Because we were over what
Yeah.
the average
Yep.
is for paid out.
and they factor in, right, inflation, especially medical inflation being somewhere between 7 and 10% year over year. The insurance company accounts for that. So not only are we running above that, but also that next year they're saying, well, if we had the same imaging, doctor visits, all those kind of things, we already need to estimate about 7% more for year-over-year costs if everything was equally the same.
That we're only doing 5.
Correct.
Now on that, just one quick question. You talked about how we were the 115,580 if the employees chipped in. What number of employees would you take? What's the number you would take to figure that out if you were?
I guess there's two ways to kind of look at that, right? Do we have an ideal budgetary number where 115, effectively is unpalatable?
Mm-hmm.
Do we have a bottom line number that we say, how do we kind of reverse this? Do we add $15, $30 to a family rate and this much to the employee rate? So we can work either that way, or we can say, hey, we want to look at $5, $15. What does that impact? And a lot of that's going to be driven off of this census that we have here.
Okay.
Right? If we go and change the premiums pretty substantially, that might change our enrollment numbers as well, right?
That's right.
Less families might enroll because if we increase it by too much,
Mm-hmm.
they choose to go somewhere else. So
Just roughly at 126 enrolled employees versus 115,000, just doing some quick math, that's about $100 a year per employee.
Mhm.
So if you charge the employees $10 a month more just to be on a single plan, you'd probably cover that 115, just rough math. And you'd still be very competitive.
yeah, which probably goes back to the supporting documents of why we're doing that. And if we look at what industry peers are doing, you guys charging $16 for employee only right now. If we bump that up to $26, we're still very much well below what other Idaho employers are charging.
Just want to look at all our options.
Yeah.
Absolutely.
I really appreciate it. Do you have any other questions? Are you done with them?
Just gotta get a copy and then.
Okay.
I'm good, thank you.
I'll email out a version so you guys have a PDF version that you guys can
Okay.
send electronically.
Okay.
There.
Yeah, if you can do that, and then we'll go from there. I
Okay.
appreciate it. Thank you for your time.
As you guys go through the budgetary season, if you want us to run numbers or something like that to look at that, just let me know, and
Okay.
yeah, we can easily do that.
Okay. Well, sounds good. You don't have any further questions, Dave? I don't. So we'll adjourn the meeting.
Thank you.
All right. Thank you.
Thank you, commissioners.